Everybody, core stability part two. Today we're going to get into functional anatomy. So part one was structural anatomy or gross anatomy. Now we're going to look at the how those structures function, specifically within the core region as we continue with this presentation. So getting right into it, we've got our same complexes. We've got our anterior lumbopelvic hip complex. We've got our posterior lumbopelvic hip complex, and then the other ones we'll discuss in a minute. So same muscles apply here. Our rectus abdominis, our internal external obliques, and the transverse abdominis. So getting into the movements of them, rectus abdominis flexes the trunk, stabilizes the spine, and decelerates trunk extension. Now, I'm going to get into this with all these muscles, but why do I need to tell you guys this, or why do I need to let you know that? It's mainly for yourselves. So now you can have an informed decision making. Once you know what each of these specific muscles does, you'll then be able to have a better idea of what you're trying to achieve, strengthen, or re-educate when it comes to an exercise of your choosing. So you can picture rectus abdominis flexing the trunk, and then when we get into decelerating trunk extension, just realize that means if a muscle does a certain action, such as trunk flexion, if you forcefully extend the spine or the trunk, that muscle is going to control the rate at which you extend. So just realize that's not really meant to be confusing. It's just meant to kind of give you an idea of what's going on. So with internal external obliques, they do trunk rotation. So we can picture internal rotation right, rotation left of the trunk, but they also at the same time stabilize the pelvis. So if you're doing something such as a plank, and 30 seconds in, a minute in, 2 minutes in, you begin to feel like that shaking, and your hips begin to almost sway a little bit. Those are the obliques. Those are all the quadratus lumborum. Those are some of those other ones trying to really stabilize your pelvis to create and maintain that foundation for you to work on. And then the transverse abdominis, as we talked about in part one, is the belt. That's the weightlifting belt. It's very important. Its really primary function is to stabilize the entire lumbopelvic hip region. So it doesn't have much of a muscle action other than that. Its goal, its purpose for being there genetically is to stabilize that region. That's why it's crucially important, okay? The posterior complex, we're looking at our iliopsoas. It is the main hip flexor of the joint. Some people call it the true hip flexor. And it also stabilizes the lumbar spine. From the structure slide, you can see how it kind of goes up through the pelvis and attaches on the anterior surface or the front surface of the lumbar spine. We've got our quadratus lumborum or QL. That's responsible for lateral trunk flexion and extension. And then we've got our rectus spinae, the group of little muscles there that does trunk extension and decelerates flexion and rotation. So from that, we can go to, this would be, we'll say, rectus abdominis, doing trunk flexion. Here we have our internal external obliques doing trunk rotation. And you can still see it there. Lateral flexion, QL activation, some of the obliques do that too. So that would be an idea of lateral trunk flexion. A couple other just ones that we made up here. We've got standing hip flexion. So this would be more of your iliopsoas, the true hip flexor. And here we've got just a trunk extension one. So like your rectus spinae, quadratus lumborum, things of that nature. So our next two are anterior upper leg complex. These are the quad muscle group, if you remember correctly. We've got a rectus femoris, which is primarily a knee extensor, but it does do some hip flexion. So this is where it gets intricate, but the iliopsoas may be the true hip flexor, but then we've got other muscles that help out and come to play there. So So just kind of remember rectus femoris as primarily a knee extensor, as well as vastus lateralis, intermedialis, and vastus medialis, lateralis, intermedialis, and medialis. Sorry. And then their primary role is knee extension, and they decelerate knee bending, right? So again, they're the opposite muscle group. So when I forcefully flex my knee, my quad group helps control the rate at which I do that. All right. And then we've got our sartorius on top. That's the muscle that kind of wraps over the whole top of the quad that does hip flexion, hip interrotation, and some knee flexion. It's got a weird set of muscle attachments, but just realize that one's the only one that's slightly different. So then our posterior upper leg complex, our hamstring muscle group. You've got your semimembranosus, semitendinosus, and biceps femoris. And they all pretty much do the same thing. They do your knee flexion, your hip extension, and some internal rotation. We've got some actions there. So here would be standing hip flexion with knee extension. So primarily the knee extensors, if you just follow kind of here, from the knee down is the extension part. But because I'm standing, my hip flexors have to contract as well. And then this next one, I think I'm going to wait for. So here we prone, or laying on my stomach, and this is knee flexion. So starting from the ground and coming up towards 90 degrees knee bend. Okay, so this would be the hamstring group that does the knee flexion. The quadricep group controls the rate of it. So next we have our medial leg, our last two complexes. We've got our medial leg complex, which is the adduction and interrotation of the femur. And then so that's starting with my leg out in space and bringing it towards the midline. I'll show you that in the next slide. And then our gluteal complex, which, remember, the glute max and the glute medius are similar. And then when you cut them away, you get the glute minimus, which is mainly the hip stabilizer. It's a small, flat muscle that lays right next to the joint line. So it's mainly a hip stabilizer. But going back to the other two, the gluteus maximus is a powerful hip extensor. So anytime that you need to create separation in the sports world or do anything forcefully from the hips, and you shoot your hips forward and extend through your hips, when we talk strength and conditioning stuff, we're talking power cleans, hang cleans, jump squats, jump lunges, things like that. The glute max is a very important hip extensor and external rotator. The glute medius is very important as well, but that one's more of a hip abductor. So it brings your leg from the midline away. So it's the opposite of the adductors or adductors. And so that's an important one to remember too. So to show you those, I tried to do this the best I could. Basically, remember with adduction or adduction, we're starting on the outside here and bringing that limb towards the midline, okay? And then hip extension, would be, again, prone, but instead of bending and using my hamstrings to bend my knee, I'm using that gluteus maximus to forcefully extend the hip upward, okay? So recap here, functional anatomy recap. Just remember, so function, action, movement, that's the main theme for this one. Movement that is not present is also very important. So, for example, anti-rotation exercises, some of you may have heard of. There are other things, but when all those muscle actions said, trunk flexion decelerates, trunk extension and stabilizes the spine, that those stabilizations are crucially important to we'll just say function. So sometimes the primary motion is for it to actually move and bend. Sometimes the action is for it just to tighten up and stabilize the spine. We'll say during maybe a contact sport, hockey, boys lacrosse, football, soccer's, a collision during softball, anything like that, where at any moment's notice, any of those muscles can just tighten up and absorb force and stabilize the spine, which again is very crucial, because you could be in the best shape, you could be a performance enhanced, very top level athlete, but if you always get injured or you can't absorb forces or stabilize your spine properly, you're going to be on the sideline with me, unfortunately. So remember, movement that's not present is also very important. Leading into training application versus informed decision making, with structural anatomy, we know the structure involved. We'll say the semitendinosis of the hamstring again. We know that you should have 0 to 120 degrees of knee flexion. What that muscle does, it flexes the knee. However, if you had a tough workout the day before, 2 days before, or you stepped wrong and felt a twinge or some pain in that muscle, and so you have full range of motion, but on the way through you experience pain or apprehension, or you're not going to fully use that muscle to what it's designed for, function is, then that leads us to, is it time to do an upper body workout, maybe have an easier day of practice, or is it something where that's actually perfectly fine? You have full range of motion, full strength, with pain 2 out of 10. That's perfectly fine. Once you warm up, that should clear up and get a little bit easier, and then you can go through it. So realize this is where this is going. We know our structure. We now know our function. This is how you as an athlete, you as a physically active person, can kind of make an informed decision. Should you practice? Should you play? Should you train? Things of that nature. Okay. So the main selling point, though, before I let you go, activation of the core musculature during training and sport specific exercises can be the greatest performance enhancement gains that any of you make, not only during this time of kind of separation from sport and quarantine and things like that. It can always be the number one performance enhancement gain. There's no supplement, no overnight 60-day, 30-day fast program or nutritional thing or strength and conditioning regimen that could help you as much as perfecting and strengthening your core daily. Okay, so some days might be days where you're really training and trying to break that muscle tissue down. Other days might be more of a recovery. Other days might be more of a maintenance. Still, other days could be more of a muscle activation. Okay, so that's my biggest takeaway for part 2, functional anatomy recap, is realize that this can be, and taking this serious can be, one of the greatest performance enhancement gains that you make during this kind of off season.